Thank you. I'm going to hopefully share some slides. Can you see those okay? Yep, fab. I can see a thumb. That's brilliant. Good afternoon, everyone. So as mentioned, I'm Gemma Jolly. I'm the Head of Health and Wellbeing at the Reading Agency. And today, alongside my colleague Amy, we're just going to provide a bit of an overview about how our Reading Well programme is supporting sort of people's health and wellbeing in rural Wales by improving their understanding and managing of sort of health and wellbeing conditions. For a bit of background, the Reading Agency is a UK charity with a mission to empower people of all ages to read, because we believe that everything changes when we read. And we use the proven power of reading to tackle some of life's biggest challenges, including that of health and well-being. So we should be about 15 or so minutes going through the presentation, and then we've got time for questions. So please don't feel shy if you've got any questions. But I just wanted to start with a bit of context, because I think it's helpful to set the scene. So we know that 1 in 4 adults experience mental health problems at some point during their life. We know that 1 in 6 children and young people have a diagnosable mental health problem. And we know that there are over 46,000 people living with dementia in Wales. And of those, over 17,000 are living in rural Wales. Alongside that, we know that around 1 in 3 people live in areas defined as rural in Wales, and that can come with some unique challenges and issues that can affect people's health and well-being. So there is generally a high proportion of older people who may have more complex needs and experience a wide range of additional challenges linked to things like transport and social isolation and increased need for health and social care services. There's a higher proportion of first language Welsh speakers, meaning services need to provide Welsh speakers to support needs, but also there needs to be access to information in Welsh. We know that the increased social isolation can be a factor in rural areas, and that can be compounded by a lack of services and poor transport, all of which can have a detrimental impact on people's health and well-being, and that there are significant challenges accessing mental health support in rural areas, and that the deprivation and isolation people in rural Wales may experience can exacerbate those mental health problems. And then we also know that digital exclusion can be a significant issue. So across Wales, around 7% of adults are not online. And we know that those who are digitally excluded are likely to be some of the heaviest users of health and social care services. And we also know that older people, people with long-term conditions, and people in rural areas are more likely to be digital excluded than their urban counterparts. That's just a bit of background to get us started. So you may be wondering why reading? Why is reading such a useful tool? So some original research undertaken by the Reading Agency has found that 1 in 3 UK adults wants to read more books about how to manage their health and well-being. However, of those, 1 in 5 of them said that it's difficult to find usable health and health information. We also know from various bits of research and evidence that readers report better overall health and well-being than non-readers, with 44% of regular readers saying reading had improved their mental health and well-being. We also know that there's many wider benefits to reading, including things like increasing empathy, raising your self-esteem, improving your employment opportunities, and inspiring creativity. So alongside why we think reading is really important, we also think public libraries are a really important resource, and they're a core delivery partner for a lot of our work at the Reading Agency. And this is because they play a key role in supporting their communities, and health and wellbeing is one of these areas, as demonstrated by the Universal Health and Wellbeing Offer, in which libraries aim to support the health and wellbeing of local people and communities through their physical space, signposting to activities, and services that inform, uplift, and engage. We also know that Welsh libraries are required to provide access to services, cultural activities, and high-quality resources in the Welsh language, which also plays a role in supporting community health and wellbeing, particularly those who have Welsh language needs. Libraries in Wales have an extensive reach, meeting the needs of a wide range of people of all ages, and data from Welsh libraries shows that library users are often among some of the most vulnerable people in communities, and they often have limited interaction with other more traditional services, so the library can be a core source of support for them. So moving on to what is Reading Well. Reading Well is a national books on prescription offer that aims to help people understand and manage their health and well-being using recommended reading. So all of the books on the Reading Well list are chosen and endorsed by health professionals, but also with people of lived experience of the conditions that we're covering. And it features a wide range of genres in terms of the types of books that are included. So everything from self-help, health information, personal stories, and fiction. We deliver in partnership with public libraries, as I mentioned, and that ensures that the access to the books is free, and it also supports wider engagement with services and access into different areas of support. And we're very fortunate in Wales to be funded from Welsh Government. We currently have 4 Reading Well lists. So we've got Reading Well for Children, which focuses on sort of worries and experiences that children may face and helpful reading for children and their families to address some of those. We've got Reading Well for Teens, again covering sort of core topics that teenagers have identified as being impactful on their well-being, including things from sort of generally sort of building resilience and looking after yourself to staying safe online, body image, and a wide range of topics. We've got Reading Well for Mental Health, which is focused on adult mental health, and that covers sort of common mental health conditions. Book-based CBT is included on that, and sort of difficult experiences that can impact mental health, such as bereavement and loss. And we also have Reading Well for Dementia, which is for people living with dementia, carers, and the wider family, and provides information and support around what dementia is, living with dementia, and where to go for additional support and information. We're also developing a new list, which will launch in June 2025, which is going to focus on perinatal mental health, and particularly the first 1,001 days to really support people access information in that time period. So in terms of Wales, Wales has a very unique place in the history of books on prescription and bibliotherapy. It was first developed in Cardiff in 2003 by Professor Neil Froud, who's a clinical psychologist. And that was the start that led to us developing Reading Well, which, thanks to Welsh Government funding, launched across Wales in 2018. So the scheme is developed and managed by us at the Reading Agency, but we work in partnership with the Society of Chief Librarians Cymru and Libraries Connected, and as mentioned, with funding from Welsh Government and Arts Council England. We also work with Books Council of Wales to deliver translation and publication of reading books in Welsh, so the books are available in English and Welsh. And we also ensure that books and that the supporting materials are available bilingually in Wales, so that people can access the information in the way that works best for them. And thanks to the funding from Welsh Government, the books and all the supporting materials are provided free to all 22 library authorities across Wales, so it's a universally accessible service. Alongside that, we undertake an annual evaluation to measure the impact across Wales and ensure that the scheme is responding to sort of government priorities, but also policy priorities and wider needs across communities in Wales. In terms of how Reading Well works, it's very much positioned as an early intervention and prevention focused programme. So it's really about supporting people outside of clinical settings and supporting that self-management. It's not a replacement for clinical care in any way, shape or form, but it's about that additional information and support that people can really get to grips with and help them to understand their health and well-being. So you can either be signposted to a Reading Well book or a scheme by a professional, be that a teacher or a health professional or anyone working in the community, or you can access the books on a self-referral basis from the open shelves of your local public library. In terms of our reach and impact, Reading Well has been running across England since 2013 and, as I mentioned, Wales since 2018. And in that time, over 3.8 million Reading Well books have been borrowed from public libraries. In 2023 and to 2024, over 35,000 Reading Well books have been issued from Welsh public libraries, with over 8,000 of those coming from rural authorities. And there have been over 5,000 loans of Welsh language books. Alongside the quantitative data, we've also got qualitative data that demonstrates that people are finding Reading Well books helpful, with 92% of adults and 100% of children finding their Reading Well book helpful, and 97% of young people saying they would recommend their book to a friend. So that's a bit of background around Reading Well. I'm now going to pass you over to Amy, who's going to talk you through how Reading Well is specifically supporting people in rural Wales.
Brilliant, thanks Gemma. So yeah, I'm going to talk a little bit more about some of the trends that have come out of the data that we collect. So we know that Reading Well has a really wide reach in rural communities in Wales. We currently gather monthly library loans data for about 7 out of the 9 rural authorities in Wales. We don't have any data, sadly, for Powys and Pembrokeshire. But this graph shows the number of book issues across all 4 Reading Well schemes in those 7 rural authorities, including the renewal figures as well and the total combined figure. So from this data that we've got, we know that Conwy and Gwynedd have the highest number of issues across all the 4 Reading Well schemes. We also know that Carmarthenshire and Gwynedd also have the highest number of renewals, so that means that individuals in those communities are keeping their Reading Well books for longer. Next slide, please. Brilliant. So yeah, this graph shows the total number of book issues by local authority for the 2023-2024 period. So in the last year, we know that Reading Well for Children was the highest issuing Reading Well scheme in all the rural authorities in Wales. That's followed closely by the Reading Well for Teens scheme, which was our second most popular. Reading Well for Mental Health is currently our oldest Reading Well scheme in Wales. So possibly why the loans are a little bit lower for that scheme. And then Reading Well for Dementia, this scheme only launched this year in May. So again, that reflects the slightly lower issue figures for that scheme. But in certain rural authorities, there are some slightly different trends that have been coming out. So unlike most of the rural authorities, Denbighshire and Monmouthshire, the Reading Well for Mental Health scheme has issued more than the teens scheme, which might reflect the specific needs of those communities and the demographics. We also know that in Ceredigion and Carmarthenshire that the Reading Well for Dementia scheme issued higher than the Reading Well for Mental Health scheme as well. So again, that's kind of indicating that there's a stronger need for information on that specific condition in those rural authorities. Next slide, please. So just to look at the data for each scheme specifically, this chart shows the total book issues and renewals across the 7 rural authorities for the last year period. We know that titles under the worries topic were the most popular in rural authorities, followed by Dealing with Tough Times and Feelings. Ruby's Worry by Tom Percival was the highest issuing and renewed book in rural Wales. It's also, rather interestingly, the highest issuing Welsh language book as well across the whole of Wales. The next highest issuing one in this list is #Goldilocks by Janine Willis and Tony Ross, which is a cautionary tale about using the internet for young people. So it's interesting the different themes that are issuing particularly well in rural authorities. If I can have the next slide, please. So again, bit of a deep dive into the Reading Well for Teens list. So in the same 7 rural authorities in the same period for last year, Healthy Minds was the most popular topic within this scheme, followed by anxiety and depression. The highest issuing titles were Be Resilient by Nicola Morgan and You Will Be Okay by Julie Stokes. We also know that the highest renewed book in rural Wales as well was Frankie's World by Aoife Dooley. So that's a little bit of a look at the teens list. If we can have the next slide, please. So moving on to the mental health list, which, as I said, is our older scheme in Wales now. I should also note as well that you'll see from the graph that personal stories is its own heading. That's because it was one of the older lists. The newer lists, personal stories are actually, they feature within each of the sections now rather than it having its own section. But we know that self-help is generally the most popular topic in rural Wales, followed by common feelings and experiences. And the highest issuing title for this scheme is the CBT Handbook by Pamela Miles and Ros Shafran. Next slide, please. And then very lastly, I'll do a quick deep dive on the dementia scheme, and then I'll move on because I know we're tight on time. But the data that we have for the dementia list, because the new list launched in this year, this data kind of straddles both lists. So this combines the data from both the older 2018 dementia list and the new Reading Well for Dementia list that launched this year in 2024, which has now replaced the 2018 list. But carers and family is the most popular topic that's come out of these lists, followed by living with dementia. And the highest issuing book so far for the new scheme is Elmer and the Gift by David McKee and Somebody I Used to Know by Wendy Mitchell. Next slide, please. So just bringing it back more to Welsh language as well, we know that Welsh language is very important in rural communities. Reading Well has had such a positive impact on the provision of Welsh language books and health information, which has been enabled by Welsh Government funding. Since Reading Well in Wales launched back in 2018, we've produced 81 new Welsh language books supporting mental health. We've issued over 80,000 Welsh language books from public libraries, and we've sold over 27,000 Welsh language books. So the original Reading Well for Dementia scheme as well that I mentioned back from 2018, that actually inspired the development of new original Welsh language books. So that includes Datod by Betty George, which was actually selected and included on the new 2024 Reading Well for Dementia list. So the charts that are currently on the screen show the total issues and renewals across the 7 rural authorities and what proportion of English and Welsh are issuing in those areas. So we know that Reading Well for Children is the most popular scheme in Welsh language in these areas, followed by Reading Well for Dementia. We also know that Reading Well for Children titles in Welsh language generally issue more than English titles in Carmarthenshire and Ceredigion. And we also know that Welsh language titles from the Reading Well for Dementia scheme were the most popular in Gwynedd. So some really interesting data that's coming out there. We also have sales data as well submitted by our partner, Books Council of Wales. And during the same time period, the highest Reading Well sales in Welsh language are for the Reading Well for Teens and the Reading Well for Children schemes. We've sold nearly 600 copies of Welsh language Reading Well titles across these rural authorities in the last year. And the highest selling Welsh language title for the last year is You Will Be Okay by Julie Stokes. So next slide, please. Yep, so I'll start wrapping up very quickly. So people living in rural communities, we know, can experience increased social isolation due to lack of services, poor transport, and can also experience digital inclusion. Libraries can support rural communities, though, to access health information by signposting to Reading Well collections and local health services. Libraries can also offer a range of community groups and activities to help people to connect with their communities. And Reading Well can support people who want to know more information about the condition that they or their family members are currently experiencing, and can support people who are on NHS waiting lists. So a range of Reading Well books are also available as ebooks in English and Welsh language. So if you're not able to get to your local library, you can access them on your smartphone device. For people who maybe can't access digital devices, public libraries also have a mobile library service and a home library service that can help rural communities access information, including Reading Well. And libraries in this context are not merely repositories of books, but they're pivotal community hubs that can foster education, culture, and digital inclusivity. If I can have the next slide, please. Fabulous. So as Gemma mentioned earlier, we're currently working on some new areas of development for Reading Well in Wales. So that includes the development of the new Reading Well list to support parents, carers, and family members, which hopefully will be launching in June 2025. We're also working on a range of activities to help further embed the scheme in Wales, including presenting at conferences and contributing to articles. We're also developing new partnerships with health and social care professionals to support the development of the new list and promote Reading Well in Wales. So this includes working with health boards, health visitors, and community health professionals. We're also aware that there are some ongoing challenges for Reading Well reaching rural communities, especially in terms of accessing libraries. So we hope that by raising awareness of the scheme and the work that libraries do, we can support rural communities to access the health information that they need. Can I have the next slide, please? So very, very quickly, to help with raising awareness, there are some bilingual leaflets for each of the Reading Well schemes available from all public library authorities in Wales. We also have some bilingual promotional materials that are available on the Reading Agency's website that are free to download. That includes toolkits and social media content. If I can have the next slide, please. And then very quickly and very lastly, if you want any more information, you can find all 4 book collections, both in English and Welsh language, on the Reading Agency's website. And you can also contact us by email as well. So if you've got any questions about Reading Well in Wales, do feel free to get in touch and follow us on social media as well. So that is it from us, I think, if there are any questions.
Yep, we've got a question in the room. Thank you for that. That was fantastic. You kind of mentioned it at the end, but I was just curious about the digital access. So I know rurally, obviously, if you can't access the library or with cuts and things like that, even just the hours that they're open, What is the capacity of the digital system at present, and are you looking at expanding it compared to the physical copies of books?
Yeah, I can start and Amy can chip in. Sorry, there's a bit of background noise. Yes, so we are aware that we try to ensure that books are available as ebooks and e-audiobooks wherever possible, so that increases the access from that. But we are aware that there is a gap in terms of how many of the titles that make it onto a Reading Well list make it into an e or an audio format, which can impact accessibility. We work closely with Books Council Wales, and they ensure sort of the e-access to books as part of a funding arrangement they have with Welsh Government to increase the number of licenses and things that libraries have for people to access. But it's an ongoing challenge, and it is something that we're looking into alongside Welsh libraries to see what we can do in that space, because I think we're aware, as you say, it's not just access, it's also opening times and also digital inclusivity. But yeah, so we're working on it, but I don't think we've got any quick answers. Amy, I don't know if you've got anything you want to add.
Yeah, just to add again that with libraries offering the home library service and the mobile library service, if digital access is an issue and people are struggling to access it that way, generally if you can get in touch with your local library service I think you can give them a call or visit them. They can order the Reading Well books for you as well and make sure that they're in those deliveries. So that's also another way of accessing those books on top of the digital access as well.
Any questions from the room? No? I haven't seen any questions popping up online, so if there's no more questions, I think I just need to thank you very much for the interesting presentation. And okay, and say this to that and enjoy your lunch. Okay.
Thanks.
Brilliant.
Nice to see you
Thanks,
all.
everyone.
Bye.
You.
That's lovely. Thank you very much. And thank you everybody for joining this breakout session this afternoon. We're really delighted to be sharing some of our experiences with you on the work that we've been doing in the St David's Peninsula. So if you just bear with me for 1 second, I'll just share my screen and hope that all of the technology works, and then I'll do some quick introductions and then we'll get going. Hopefully it should be coming up now. Go. So yeah, as I just said, we're here to talk about some of the work that we've been doing in the St David's Peninsula around co-producing integrated community health and wellbeing services in the area. Just to tell you a little bit about some of the background and history as to why this work is happening, and let you know about the journey that we have just started and are really looking forward to continuing over the coming months and years. So firstly, just to introduce myself, my name's Lisa Davis. I'm the Service Delivery Manager for Proactive and Planned Care, working in the Pembrokeshire County Management Team within Hull Var University Health Board. So my role is responsible for supporting integrated working in the Pembrokeshire area across community health and social care, and then I also have some operational responsibilities for community nursing teams and for instance district nursing teams and specialist nursing clinics, etc. And I'm really delighted to be joined by Sue Denman, who is a community representative as part of the St David's Peninsula work and also the founder of Together for Change. So I'll be doing the majority of the slides today, but I'll be really delighted to welcome Sue in to share some of her experiences also. Just to start really briefly with the national strategic context, I won't dwell on these slides too much. Everybody's aware of these national strategic drivers. A Healthier Wales, published in 2018, looking at that whole system approach to health and social care, and the Wellbeing of Future Generations Wales Act 2015, and the law around working together to improve our environment, economy, society and culture. And I won't go through all of the detail, but I just wanted to call out a couple of really key strategic drivers from these national pieces of work that are impacting on the local work that we're doing in the St David's Peninsula. And firstly, within a healthier Wales, the drive towards long, healthier and happier lives, and maintaining care as close to home for as long as possible, a whole system approach to health and social care, and I would say in particular working across the whole sector, working with our partners in the third sector and community as well. An equitable system which achieves equal health outcomes for all, and again services which are seamless and delivered as close to home as possible. And then in terms of the Wellbeing of Future Generations Act, obviously a healthier Wales being one of the main drivers, but in terms of some of the things that we are as a health board committed to in the work that we're doing with our communities is around looking at taking account of the long term, helping prevent problems or avoiding them from getting worse, and taking that integrated and collaborative approach. And hopefully through the coming slides that you'll see or get a flavour of how we're trying to do that in a specific area here in West Wales. So in terms of our local context, some of you will be familiar with the Health Board strategy, Healthier Mid and West Wales. And I just wanted to call out again what our vision is within Whole of our University Health Board for everyone to live happy, healthy lives full of joy, purpose and feeling like they belong. And this really underpins again the work that we are trying to do in the Pembrokeshire Peninsula, and bringing in all of the relevant partners as part of that work to make sure that we're co-designing and co-developing this vision for the future. And in particular that we want to support communities to be connected, supportive, adaptive, resilient and resourceful. So how can we recognise the small amount of input that the Health Board has in terms of the people's health and happiness and well-being, an important part but a small part of it, of what keeps people happy and healthy and at home for as long as possible. So again, the work that we're doing around co-production is making sure that we're developing, working with partners, solutions that matter most to local people, and connecting and building on the strengths of communities so that people have a sense of belonging and are supported to stay well. And those are our key drivers as part of the work that we are doing in this area. So I'll just hand over to Sue, who's going to quickly give you a bit of an introduction around the Pembrokeshire Peninsula and say a few words about the area, just to give you a flavour of the context.
Thank you, Lisa. You see on the map the area that the working group is considering. It covers 3 electoral wards, or almost the 3 wards, I think, because the Health Board boundaries are a little bit different. And this is an area with a population of about 5,300 people. The assets vary considerably, although I would say that all the wards are very, very rich in assets. We have buildings, a lot of interest groups, and generally it's an affluent society, but with pockets of deprivation that is often hidden from view. But overall, I would say that there is a degree of affluence with money coming in, brought in by retired people. The age range is skewed towards elderly people, but there are young families as well scattered about the communities. Now, I have to mention to you that whilst the assets built and human are quite rich in the sense of buildings and clubs and pubs, services are declining. And it seems to me, as a member of one of the communities, Solva, that we seem to be locked into a perennial battle to save our services. Transport is poor. Work is seasonal and low paid. We've lost our swimming pool. We've lost our bank in this area as well. And we're currently fighting to save our recycling centre. Solva School has partially closed, although the schools in the St David's ward have been saved. So it's a little bit of a bleak picture, because it seems to us that rural areas in Wales are not prioritised and protected by the Welsh Government as they are in Scotland. But there are lots and lots of positive things going on, and I would say that the working group that Lisa is chairing is one of those, because it's taking a holistic view of what the wellbeing services and groups are doing to try and bring it together to create better conditions so that people live well and feel good about their communities. Okay.
Thank you, Sue. And yeah, in addition to all of the challenges that Sue's outlined in terms of public services, we have recently experienced some sustainability issues in relation to our two GP practices that existed in the area. So that includes Solva and St David's GP practices. Initially, Solva, there was issues around the resignation of the GMS contract in Solva around 18 months ago, upwards of 18 months ago, which resulted in the establishment of a stakeholder group that the Health Board was responsible for chairing, but involved a number of key stakeholders who had an interest in sustainability of GMS services in the area. Through the work of that stakeholder group and our primary care colleagues were able to secure the future of Solva surgery about 18 months ago through that being taken on as a managed practice by the Health Board. We worked towards a vision for a single peninsula practice to be developed over the next 5 years, co-produced through a working group. So back in January, the working group was to be established, and when I came into post in April was to chair the group. But unfortunately, those timescales were accelerated somewhat in April when the GP who currently holding the contract in St David's also tendered his resignation due to sustainability issues, giving 6 months' notice. So members of the stakeholder group had to come together a lot more quickly to try and look at how we could secure the sustainability of this the future peninsula area provision, whilst also keeping in mind the longer term vision, which was for as Sue described, understanding all of the assets and networks that contribute towards keeping people healthy, well, and at home for as long as possible. So the working group was then established at pace in April 2024, designed to address those challenges of the immediate closure of St David's surgery and what was going to happen with all of the patients that were currently in St David's, but also that longer term vision. So I've just put the purpose up on the screen of the working group. So it really was to provide that forum for discussion amongst stakeholders being from across communities being served by the Health Board regarding the future vision for healthcare and wellbeing services. And it's really important to reiterate that we wanted this group to look at that wider vision and not purely the delivery of GP services, because we recognise that the small role that services have to play in terms of people's health, but also that we were going to be basing this on an operational model for healthcare provision, but co-produced by Pembrokeshire Peninsula stakeholders. This part of the working group was to progress the practical discussions rather than the higher level discussions that were happening at the stakeholder group. So starting to think about models and options that we could present back to the stakeholder group for consideration in terms of what the model for healthcare and wellbeing would look like in the peninsula. And really importantly, the role of the working group is to ensure that the community has a voice. So we've got a number of community representatives on the group to ensure that they're heard and their voices are represented in terms of what the future of the provision looks like in the peninsula area. So just to give you a sense of how the working group is configured. So we've got, as I said, community representatives from the St David's, Solva, Llanrhian and Brodie City or Community Council. So we've tried to cast the net as widely as possible. I just want to say I've got Solva and St David's logos on the screen. That's because the others don't have logos, not because they're not important, but I just wanted to give a bit of a graphic there. We've got additional co-opted community members, so we don't just have representatives that are coming from the community in city councils. We've got interested community members involved in the group as well. We have representatives from the GP practice, so that would involve the GP lead and the practice manager. We have representatives from a number of different health board teams across primary care, the cluster, community pharmacy and the community team, which is who I represent. We have representatives from local authority adult and children's social services. We have representatives from Pembrokeshire Association of Voluntary Services, who was there to represent the third sector, obviously. And then we have the opportunity to co-opt further representatives as and when, and that's something that we've started to do with bringing in key expertise to the group to provide information, advice and support as we're going forward. I won't dwell much again on this slide because I'm conscious there is a lot of content on it, but these are the objectives of the working group, and I've just highlighted a couple of the key aspects that we're responsible for. Again, co-production. Secondly, and I think it's picking up on something that Sue mentioned earlier, is identifying population need and demand, but also importantly matching that to the statutory services and community assets that we've already got. So what are the health needs, healthcare and wellbeing needs in that area, and what services have we got, and where are the gaps, and how can the working group work together to design options and solutions to address those gaps. Again, reiterating, the model looks at healthcare and wellbeing, so we're not just focusing primarily on the GP practice, we're casting the net much wider, and also ensuring that we're aligning with the health board's strategic direction. So again, calling out the from the third slide, care closer to home and the importance of delivering those sustainable services where people can access them. We work really closely with and across statutory, voluntary and third sector partners, so we recognise the role that everybody has to play in that. And then importantly, we have a drive to look at novel models that work in a rural community and see how we can deliver something that might influence across the whole of Wales or further afield, in terms of how we can work creatively and think differently around the services that we deliver in a rural community, working really, really closely with the local population on what's important to them. And we'd really have a view to influence politicians and the government around this going forward. And finally, and really, really importantly, ensuring that we're maintaining a research and development role, so that we are bringing in experience from elsewhere. We're building on what we already know from the area, both from a qualitative and quantitative perspective, and we're learning from what works elsewhere, both within the UK and globally. So that's a piece of work that we've already started. So you can see we've got quite a lot of objectives, quite a big ambition. I'm going to hand back over to Sue, who's going to give you a little bit more information about the evidence that we're building on.
Thanks, Lisa. I'm going to pick up on the R&D objective that Lisa included in her list. In fact, many of those objectives that she just covered require the pulling together of data, and obviously routine data are really important, but we are also considering community-led data that have been collected by Together for Change through various projects that we've run in recent years. Many of you may have heard about Together for Change. We've been very active in the county and in the region in the field of research and evaluation. So I'd like to mention a few of these projects that the working group is going to be drawing on. The first one was a qualitative research study which asked the residents of the parish of Solva what well-being meant to them, you know, what was important to them, what made them feel well and to feel that they lived well. And we were quite interested in some of the issues that came out of that research study, because as to be expected, good mental health, the importance of the environment, which is very beautiful here, were both mentioned, having things to do, having a sense of belonging and good connections with people were mentioned often. Services were less important to people unless they needed services and were currently using them. So this qualitative work has been rolled out across the peninsula through the third project on that list, which is the Four Wards project, which I'll talk about in a moment. Now, the second relevant project focused on assets at parish level. We collated by hand the assets of the parishes across Pembrokeshire, so all the built assets, the human assets, and we're in the process of actually working with Cardiff University to strengthen that resource, make it online and make it an engagement tool. Now, the hand-collated asset work is very useful to the working group, but I think the engagement tool, which we hope will be piloted in the St David's and nearby communities, will be even more useful, because they will be able to draw in community members and to really assess what they've got and what they need and what the gaps are. So please look at our website if you're interested in that project, because it's in the development stage, and Lisa and the working group are showing a lot of interest in that. The third project is called Forwards. In fact, Jessie Buchanan and I presented on the Forwards project at this conference a couple of years ago. But what's very, very positive for us is that the working group is picking up on the findings of that, reviewing and renewing it as well, but nevertheless looking at it carefully. Basically, what we did was we trained local people as researchers, and they interviewed individuals and groups on what was important to them. And consensus was reached across the 3 parishes that there was massive opportunities for collaboration across, key areas of concern. And the top ones were social care and health, a sustainable environment, sustainable tourism, and housing. So again, these are relevant findings for the working group, which are currently being considered. And finally, just to finish my contribution, both City Council and Solva Community Council ran their own consultation events when word came out that the general practices were under threat. At least that's what the interpretation was. In fact, it was a consultation that was being run by the Health Board, but nevertheless, people were very exercised by the fact that the GP-led services might close down. I can only speak for Solva, but we held a town hall meeting that was attended by 120 people. And whilst people were adamant that the service, GP-led services, had to be saved, nevertheless, they were very interested in taking this as an opportunity to look at wellbeing services more generally, to look at how they could be better integrated, how the organisations could work better. And absolutely delighted that Lisa has picked up that challenge and is now taking it a stage further through the work of the working group. Over to you, Lisa.
Thanks, Sue. It's really good to hear about the work that's been happening in the communities and what we're building on. So I'll just move on now briefly to the next couple of slides, and I won't be talking for too much longer, but just to give you an update on the focus of the work initially that we've been doing within the working group. So it's fair to say that the focus of the group initially has been on the short term, because the news of the closure of St David's surgery was obviously very challenging and very difficult for the community to deal with, and we've worked really hard within the health board to ensure that we're able to provide a solution that is as acceptable to the community as possible. So the outcome of the health board's decision was that the majority of patients from St David's practice were to be dispersed to Solva practice, and we were to establish a new surgery called Meddygfa Penrhyn Peninsula practice to cover the whole of the Pembrokeshire Peninsula area. So that results in the just over 2,500 patients moving to a new practice, which happened just last Friday actually, and so far I think has been a success. Notwithstanding, there are still some community concerns, and it would be remiss of me not to call out the fact that the community do still have some concerns around travelling, but we've done everything that we can to mitigate that from the perspective of the health board. But that being said, that is part of a intermediate solution. So the longer term vision is for that single peninsula practice, and whilst at the moment we've got that located where it is, we're open-minded as to what the future will bring for that peninsula practice and where it's located in the future. The medium to long term, we're now starting to focus on, which is again going back to looking at what the population needs in the area and what the demands are for healthcare and wellbeing services, and very much building on what Sue described, the work that we've already done with these communities and what's important to the communities. And our intention is definitely to go back out very soon to engage with the communities once things have settled down a little bit in terms of the location of the practice. I'll just jump back a sec just to say, just to clarify that some patients in the peninsula area have been dispersed to other practices, but on the basis of geography. So the majority of the patients are within that geographical area of the Pembrokeshire Peninsula. And then we're also now in a process of looking at how we can start to map the provision of statutory services and community assets. So we're starting to build on the work that's already taken place, but going out and saying what are those human and physical resources and assets that already exist within the area, and how we can start kind of building on those. I won't dwell too much on this, but it was really important that we have a focus on what matters to the community. And whilst we haven't gone out to engage with the community on this as yet, we did ask our working group as representatives of their community to call out what they thought was important and what mattered to the people that they represent. So we first asked, how do people want to live their lives, and what do we as organisations or representatives want for people? And you can see on the screen there were an abundance of answers to this, but I've highlighted a couple that I thought were important in terms of representing the community and that wider vision of not just access to GPs and primary cares, but it's that wider wellbeing, it's that care, it's that maintaining independence, and a number of important other aspects around connections and things that Sue mentioned earlier from the research that we've already undertaken in the area. And then we've got, we asked the questions around what's preventing these aspirations and what support or changes can be put in place to make these aspirations a reality. And I highlighted all of those in the second column because I think they're all really important. And again, it's around the importance of involving and listening to the community and taking a strengths-based approach. What have we already got and what can we build on? There are some structural challenges, financial challenges, which we'll all be aware of around what's preventing us from achieving these aspirations. But I think we've got the ideal ingredients within the working group to think creatively to overcome some of these barriers and not go to the obvious and think a little bit more creatively about what we've got. So finally, we've got what a slide on kind of success. What does success look like? Where do we think we'll be in a few years when we've successfully built and delivered the models that we've designed through the working group? And again, it's healthy, happy, independent communities who can access help when they need it from a range of different places. A co-produced healthcare and wellbeing solution achieved through active community involvement. A thriving and sustainable primary care provision in the peninsula. An active community network with good connections within and across communities, and increased levels of satisfaction with services that are delivered closer to people. But we acknowledge a number of things that we need in order to achieve this success, and that is building on the work that we've already started through the working group, effective, open and transparent relationships between all stakeholders, and that's been really important to us from the Health Board to make sure that we've got off on the right foot from the start. That research and development approach that Sue's really emphasised, and how important it is to learn from what research we've undertaken, but also the models that exist elsewhere. Active, again, and really transparent communication, and making sure that we're there to answer, not only to answer the questions that are coming back from our communities, but proactively going out there and engaging and offering that information. And again, community engagement and co-production, which is a real core principle of the work that we're doing, and we're very fortunate to have partners in our third sector who are able to support us with this as well. And just moving on to the last slide then, in terms of next steps. So as we've moved from that initial kind of short-term focus on the sustainability of the GP provision within the area, we're starting to look at options for consideration by the stakeholder group, which are that kind of wider focus around healthcare and wellbeing of the population. We're looking at establishing a couple of subgroups to accelerate the work. We meet monthly, but it's not fast enough, so we definitely need to empower some of our community representatives and stakeholders to lead those subgroups and drive that work forward. we have started on the process of considering other models around the UK and wider, and we're really lucky to build on the work that was already undertaken to support the Solver surgery work about 18 months ago that Jessie Buchanan from Together for Change supported with. We're really grateful to build on that work. And finally, further engagement, as I've mentioned, with the local community, which is really important and something that we want to plan, but we want to make sure we're considerate around the timing and giving the community the opportunity to share their thoughts with us at the right time to start with, and then going forward. So that's it. Thank you very much. And if there are any questions, we'd be really happy to take them if we've got time.
Yeah, I've got a question. I'm also conscious of time, but yeah, so my name's Jane Spivey. I'm a Macmillan AHP Cancer Lead for Powys Teaching Health Board, and my role currently sits in the Improving Cancer Journey in Powys. And in terms of what we do, co-production, stakeholder engagement is key in terms of what we do really to ensure that people are feeling supported in Powys who are living with or affected by cancer. And I feel like as a service we need to improve our patient voice, and I'd be really keen to know how you sort of got buy-in from the community, how you recruited into the working group. If it's quite, I appreciate we're short for time, so I'm happy to follow up with an email or another meeting, but if in a nutshell, if you're able to sort of share that with me, that'd be useful.
Yeah, I would say if we have got time, I would say we probably haven't cracked that nut yet. To be honest, we've got really good community representation through our organisation. So we've got our community councils and our city councils represented, and we've got some community co-opted members. But I think we need to do a little bit more work. I don't know if you agree, Sue, to get a wider range of voices heard through our working group, and we're working with colleagues in PAVS, our third sector organisation, to enable that to happen. So I don't know if you wanted to say anything else.
Yeah, thanks, Lisa. It's a really good question. I think in both communities, there is a very, very strong community spirit. And as soon as the communities heard that the general practice-led services would be under threat, they created their own community groups, pressure groups, I have to call them that. And from that has grown that wider engagement. So I would say that the representatives on the working group have got their branches through into the community. We also have a joint newsletter here, which is used to report on how the working group is progressing. So there are a number of ways of communicating out and also drawing that information in, but obviously we'll have to see whether that can be sustained over time.
Any other questions? No? Okie dokie. Online. Okay, thank you very much, Lisa and Sue.
Thank you very much.
Thank you, everyone.
Thank you.
Have a good rest of your day.
Thank
Thank
you.
you. Bye-bye.
Bye.
Thank you. Welcome everybody, select few to this presentation. I'm Paul Underwood. Mandy Westcott's here with us, and Jess Svets is on the Teams section. But we're presenting this for a large number of people across many agencies. And we do have representation in the list there from Pembrokeshire County Council and from the RIC Hub, as well as myself from Haldar, Jess from Haldar, and Mandy from Improvement Cymru. The pictures at the bottom are the emergency department at Withybush, and the picture on the left with all the ambulances is the state that we were arriving at. And the picture on the right is our future state, which maybe we are starting to arrive at. And part of the reason for that is going to be what we're doing in Port Preseli. So what is Port Preseli? Well, I'm going to tell the story of how we got to where we are. I'm going to tell a story of where we're hoping to go. But that's at the moment, I'm going to have to start in the present. So this is our infographic of the system of acute and emergency care that we are trying to co-create in the county of Pembrokeshire. And it is shared across into the other counties for health in Haldar, but it's strongest in Pembrokeshire. And this picture was created in Pembrokeshire, and there is a whole story to the creation of this. This is not a given picture. This is something that has emerged from all the work we're doing. What is Porth Braceli? Porth Braceli is that bit up in the top there. It's the heart of the system. It is the hive. There's a picture there, or several pictures collaged, which is giving you an image of Porth Braceli as a lot of phone lines and people working together in an office space that they share. And then there's breakout rooms, and that's always something in development, the breakout rooms. Porth Braceli is complex. Porth Braceli is a communications and coordination hive. It's an aspiration as much as it is something that we've already managed to deliver. It's a coming together of multiple agencies. It's a coming together of WAST. It's a coming together of the social services. It's the hospital. It's primary care. It's the intermediate care teams. It's the art team. It's any services you can imagine would be needing to respond to a social care or health emergency. It's bringing us all together and as far upstream as we can, but accepting that this is all still reactive. So you can go further upstream, but you have to become proactive when you go further upstream. And that was actually the subject of the previous talk, because there is actually a whole body of work we're also involved in, which is the before Porth Braceli. But this is the story of Porth Braceli. It is a multi-agency hub and hive. It's co-located to integrate processes. It's whole system awareness. It's both expansive learning and situational learning. You'll find a bit more about that later. The journey to get there. So now that we know what it is, this has been a journey of maybe 15 years, maybe 2.5 years, actively striving for this. This is, in the main, a journey of everybody involved, and it's a journey of the heart. It's a doing what's right, or striving to do what's right. It's very organic. It's as straightforward as we can make it. It's based on trust, and it's based on respecting each other. It's got metaphors throughout. It's very humanistic, and one strong metaphor is to be like water. But there is a second journey in here, and I'm a member of the group who is part of the third journey, but it is also in the second journey. There's a guiding coalition. There's something very cerebral. There's something very complex that is stewarding this. It's systems thinking, it's complexity thinking. It is not linear. It isn't controllable. It is expansive. It is situational. It has two examples, very strong examples of complexity, and I'm going to try to give a hint of those in the presentation. Those two journeys are linked by metaphor, storytelling, co-creation, and learning, and the process coming across into the journey of all that we could describe as stewarding. That's perhaps how we'd like people to understand what Porth Braceli is as a hive. Those are words which we might use to describe, and pictures we might use to describe what we are attempting to achieve here. That the metaphor on the left is also very powerful in terms of what we've been doing and the words that are included in there. And a lot of what we do when we're stewarding is towards that, more of what's on the left, less of what's on the right. Deliberately choosing the metaphors and the words and the language on the left over the language and metaphors on the right. So I'm going to take a first dive into complexity. Anything that's got a green background is quite complex. So a little warning, anything that's bluer is hopefully easier to understand. Complexity matters. We are in a VUCA world, and the VUCA is getting more and more and more. This is an early representation from a complexity group in one of our UK universities to describe what complexity might be. And complexity sits further from certainty and further from agreement. And if you take those two concepts, further from certainty, we need learning for change. Nearer to certainty, we need to stabilise things, and we need learning for stability. As we go further from agreement, we are undoubtedly going to have multiple viewpoints, and we are in a collective. And as we get more and more individual, then we are nearer to agreement, because in the end we should be able to agree with ourselves. And so there are two crossovers here, and I want to use those two to jump into the next slide, which describes healthcare as a field of uncertainty and challenge. Remember that the complexity is up in the top right. So we can describe medicine and healthcare in according to those quadrants. And in the bottom left, we have professional craft medicine. Up in the top left, hierarchically organised medicine. To the bottom right, we can go into private practice, and then we can go up into the top right into the complex field around collaborative communities of medicine. And we have craft medicine, craft expertise in the bottom right. That's traditional medicine, art bespoke tradition. Up into the top left, we go to our bureaucratic expertise. That's where our organisations are. They capture, they codify, they command, and they control to create stability and generate control. To the bottom right, we don't talk about that because that's predominantly private practice. And then up to the top right is where we are entering the complex, the adaptive, the social change. We're very good at all the green. We have a up in the top right. That's where our organisations are, and that's where we've got to. And we have this problem up in the top right that we don't seem to be able to enter into that void. So that's problem number one. How do we deal with that void? Well, I'm going to have to take you into systems thinking. So another green slide predominantly. And this is how we typically think as individuals, subjects using instruments to act on objects according to our motives to get our outcomes. And we tend to forget all about the other people who are involved and all the rules that we need to be in line with. We forget the system. This is one representation of a system. This is how systems thinking can expand our minds. There are other ways, many other ways of doing systems thinking. This is just one way that fits in with what I'm talking here. And the reason it fits in is because it leads into this slide, where we're learning for change. What can we do in that top right? This is Engstrom's models of expansive learning. So we've got our one human activity system here with its outcome. If we bring together and we share outcomes, we have a common outcome. So we have a shared object, and that might be a patient and patient need. Well, within that shared object, we can start to work together and do some things. And you can call it, as Engstrom did, not working, because you can tie knots together and you can untie knots together and around change and issues. That leads to ripples and splashes and waves that impact out into the wider system. And then if you are aware of that, some of them will be creating contradictions. And if you start to resolve some of those contradictions, so you're not working and you're resolving contradictions that land within the wider system, then you can develop what he called expansive learning. So what did we do? Well, our journey, as I said, started in earnest about 2.5 years ago with a value-based healthcare project. There are 3 elements on this slide that I want to specifically relate to. The first is on the right-hand side. We did a lot of work around quality and safety, around continuous improvement, and around pathways. Lots and lots of work. We hit a ceiling. We hit a ceiling of change that we could not get past. The bottom left is showing one of the activities we did, which we created a team meeting, and this is one of our best attended team meetings. It's around same-day emergency care. We have our chief exec here. We have people from many agencies who have come into this meeting. We use this as our change meeting, and this meeting continues. It is a coming together of people. It's non-hierarchical. It is psychologically safe area where we can plan and act, and we do a lot of innovation that stems out of this meeting. And then the third thing I wanted to bring to is in the middle there, which is that early on we started something called a Rich Picture Collaborative, where we went out to all the stakeholders who SDEC work with, and we ask the questions about what we do together, how can we make things better, how can we understand what we need to do. And that was the leader into the next stage. But I mentioned we hit a ceiling. We hit a ceiling of change that we couldn't get past. Everything we were doing was collaborative, but we were still foiling into a void. We were learning together. This was expansive learning together. We fell into the void. We hit the glass ceiling. Are we actually holding enough people here in order to keep this project going, even though we have a lot of people involved? So this is the really complex one, I'm afraid. This is the second void that I'm going to build to now. If we consider everything we do as being within disciplines or transdisciplinary, we can get a line like that. We can think about the past, the present, and the immediate short term, and the future. This is where we live. We live ourselves in the disciplinary present. We are in our silos. We live our silos. We are our silos. This is where we have reductionism. This is where we break things down into the smallest parts to try to understand them. This is science. This is technology. This is the Western tradition. Now, we try to go into the future, but it is an illusion. We imagine into the future, but we have got no route to get there. And what happens is that we run in the disciplines and we create a future that is disciplinary. And there is no route back up into the multidisciplinary from the disciplinary, because we're just running down the rabbit hole further and further. We're staying in our swim lanes and we cannot get across into the other lanes. Where we need to go is into this region, which has been coined by Catherine Hobbs, whose book this is based on. This is research from Business School up in Hull, which is a very systems thinking oriented research group. The empty quarter, we're not getting it. It's the holism, it's the together, it's the holistic approach to things, it's the emergent dynamic, it's the space for people to think. It's the space to let go, to see what emerges together. It is our source of practical wisdom, and that is a void. And the only route up into our transdisciplinary futures, our together future, is through that void. And we are not able to go there because we keep defaulting into the disciplinary futures. And we rely on technology and we rely on science for our solutions. And that's what we have there, and it's getting worse in that context. So what can we do about it? This is very diagrammatic. I haven't got all the answers to this. This is really, really complex, how we solve into this empty quarter. But what we do have to do is we have to network widely, and we have to try to cover the gap, try to cover the void, networking really expansively and getting as many people involved as we can on the issue that we are trying to do. And together we have to create a safe zone where we can then do the communities of practice work, and we can do the expansive learning. And through creating a safe zone with communities of practice, we can learn, we get situational learning. Through doing the expansive learning in there and the not working and the resolving contradictions, seeding our change into there, we get the expansive learning. And that is how Porth Brusselli was born, into that arena. And hopefully, maybe in the future, we'll be able to take away the redness to the background. So again, how did Porth Brusselli come about? Started with this rich picture journey where we are co-creating, we're creating images of what we all feel we need into the future. We're creating a community of practice, starting to network across the whole county and wider. We're creating a stronger community of practice. We're now with the Bevan Commission in this project, so we're using a strong vehicle of change. We're meeting in major meetings as a whole system to understand what we're trying to achieve together. We're creating where I started, which is our infographic of what we're trying to achieve. We have a whole organic approach to it, which was the basis of our Bevan project. And we have Porth Brusselli, which is coming to be as a consequence of all of that work. Evaluating this sort of thing is really hard. and we're only early in the journey of evaluation, but we are using most significant change with the help of DEEP in Swansea University, and these are some of the early findings from the work we're doing, collating some of the messages we're getting back, and I'll just let you read some of those rather than me read them through. But this is overwhelmingly positive, the impact on the people that we are with, and this is many people's lives. This is the coming together of many people in our region who are delivering or attempting to deliver to what people require. So I've got a summary run now of the two interconnected journeys. This journey of the heart on very much on the left here that we're all trying to go down, and the mind. And how does the journey of the mind bring this to bear? Well, it's stewarding, system stewarding all the way. It's leadership that can be adaptive. It can be servant leadership. It can be transformational leadership. It can be distributed leadership. There are many different models of leadership that would work here. It's the use of stories and metaphor. It's, as people are open to it, it's providing them with the skills to collaboration. And we have a program of collaborative communications training, which is being provided as people are open to it. We need to help them embrace systems thinking, and in Pembrokeshire, in conjunction with local authority, we are using Vanguard as our first real taste of systems thinking for many. And this is very, very unusual that a health organisation is combining with a social with a local authority and delivering a Vanguard together. But there's a whole load of other stuff which is behind, which is a collective, and a lot of this is me with others who I'm bringing along, where we are. If you don't know what you can do, if you do not know what is possible, you cannot even conceive of doing it. So there is a whole art of the possible which sits behind, and we use this whole art of the possible and we bring it across into the left side as metaphor and language. And positivity and skill sets that we introduce people to as they are open to it. And as a consequence of that, we get collaboration, purpose and focus, engagement, and a whole mass of expansive and liberating organic development, which is very, very high in energy. It generates a lot of learning through the shared characteristic, the situational learning, expansive learning, the active nature of all of this. And that's our journey going forward, because it's about capitalizing on that now. And how do we supercharge all of this with learning? I've used the term human learning systems because that's where we're going, and that's where Mandy comes in.
Yeah, thanks, Paul. We're going to try to click on this lead by presenting. So there we are. I'm Mandy Westcott, as it says there. I work for Improvement Cymru, and as such, my role is, and my team's role is helping to support the delivery of integrated health and care services that goes across sectors, that goes across agencies, and also across disciplines as well. So today, just going to explain just a little bit of my role and the aspirations that we have for working in this type of way. So Paul mentioned human learning systems, and for some people they might have heard of it, for others just 3 words that they hadn't joined together before. So you might be asking, what is human learning systems? And I'm just going to explain in very brief terms of what that is, those 3 words. First of all, it's the human aspect of it, and it's a way of making public services bespoke, really, to the needs of the individuals that we're seeking to serve. And then it looks about learning. It's a way of prioritising learning over the need just to deliver targets. And as long as you've got those targets ticked off, you're supposed to have learned. It's not. It's about the deep learning that occurs within the work that we're doing. And so performance improvement is driven not by targets, but by continuous learning and adaptation. Can't say that one. And then the other thing is about a systemic approach to it as well. It relies on leadership to foster the conditions in which this learning can take place across the system. And this is really important because, as Paul explained, we're working within health and care in very complex situations. And in complex environments, we need continuous learning if performance is to improve. And that is performance improvement, not performance targets. And also continuous learning enables us as workers to practice ways of improving. And this is through experimentation, data gathering, sense making, and a lot of reflection as well in the work that we're doing. And why this is also important is because you can't say this worked there, so it's going to work here, or this worked even in the same organization 10 months ago, so it's going to work again in the future. It's that process of continuous adaptation that is going to help, and it's that deep learning. So human learning systems draws our attention onto these three very important words: being human, being relational in everything that we do, being learning centric. And by doing that, we begin to work across the system. So this is just a quick framework. I know you've seen lots of diagrams today, but this is just briefly what it looks like. There's 5 elements of work. And so the first thing that we need to do is understand the system. And Paul has been explaining how he's been doing that through rich pictures. And here we're looking for the outcome that we all want. Then and you work with the actors, the factors in the system. You build trust, which takes a long time, and it's long and it's hard and it's often slow. But from that, you begin to create an understanding of what's needed. And then from that, from these strong relationships, you can build and decide what you need to do. Co-create the experiment or the exploration that you want to do, the thing you want to try differently. And then you go through a process of learning, keeping that iteration going as you learn and unlearn, and then you reflect and you unlearn and you learn again, with not just us as professionals, but with the people who, the public that we serve. So from that, then, this structured exploration, then you begin to think that work, that's really important. That should now come into, it should be embedded. It should begin to influence people. This is a really good way to work, and eventually becomes the way that we work, the business as usual, but in a much better way, because it's human, it's learning centered, and it's got a systemic approach to it. And central to all that is the role of this system steward. Paul talked about system stewarding. It's coming and making sure that that learning that's happening is being sent up and down and across as well. It doesn't get stuck anywhere. It doesn't get stuck in your lessons learning log somewhere on somebody's laptop that nobody's ever going to see in their life again. So how we came into this space is that our team was able to convene people across ways, and there was a huge amount of people across ways who were interested in human learning systems. They might have heard of it. They might be doing work that you couldn't call. They wouldn't badge it as such. So they were saying, are we doing it? Are we doing it right? If so, we don't know if we are. And should we be doing it? What's the evidence base for this? So we were able to put a full programme that ran from November to January of raising awareness about what human learning system was. And people from across Wales came, across sectors, across levels of hierarchy, all came and found out and learned together. And there's some of you here that experienced that as well. And that was just one part of the programme. So we had the sessions there, then we had lots of bite-sized sessions with Academy Wales. And this is what we did next. And this is where we connected with Paul and colleagues there, is that we began to think about a collaborative design of what place-based change would look like. So this is where we are now, as our organisation is supporting three health boards and partners within that footprint of those health boards. So there's one in Betsy, there's one in Holgar, and then there's one in Cwntaf Morgannwg, which are rural, for lots of these areas, they are rural areas as well. And so we are coming alongside them, and we are commissioning an external learning partner to come and work with the guys. You said that you can get a little stuck. A learning partner, particularly an external one, can come along and help think about the practice, help support the development of a culture of learning and help people to reflect on their systems change practice and then act on what they're learning, share this learning to perhaps create wider influence for change as well. And the way they practically do this is helping organisations understand the real importance of learning, particularly when you're tackling complex challenges, facilitate peer learning, and then working collaboratively and taking an emergent and iterative, keep learning, and particularly amplifying the voice of the communities that we work with as well. And then develop learning cultures, capabilities and practices within that organisation, and also beginning to co-design new learning frameworks and tools. So that's what's going to happen with Paul. That's part of Paul's future and his colleagues within Port Preseli. So just also there's that work that we're supporting with across Wales. We've also, my role has been building lots of connections and relationships, and particularly keen to work with colleagues in Social Care Wales, because this is a false divide between care and social care and health care, and working with colleagues in Public Health Wales and the wider determinants of health, working with national commissioning colleagues in Welsh Government, particularly those in education, and thinking about the school as a community and all the health and care implications around that, RPBs, third sector, and also universities. So while I think within Wales we all know each other and we're well connected, it's about, are we connected well? And there's a difference. So within that space then is the next thing that we're doing is building and developing learning communities. So thinking about that idea of connecting well is really important. So again, that's part of my role, is convening people across Wales who are like-minded, who want to take lowercase human learning systems approach to their work and bringing people together. And we've had one event, we've got another event coming up in December, and then we're going to have an in-person event in January, and it's just really just coming together with like-minded people, because the work is long, it is hard, and it is often slow, and so you need each other while you're doing this work. So if anybody is interested in being part of that, please let me know. And then the other thing is, again, is that I'm interested in it as a researcher as well. I have a senior Bevan fellowship around this, and that's the type of work that I'll be doing for Bevan. Hopefully ultimately creating lots of case studies across Wales that are building this evidence base, for this is the way of working that is better for the public service and for the people that we seek to serve, and also better for us as well as public servants. And I'm connected to, there's a national HLS collaborative, it's got international links as well, I'm part of that. So I'm bringing the evidence back to Wales and sharing that as well. And in regular contact with the architects of this HLS model or approach, and using those connections to connect them with universities across Wales, in Bangor, in Cardiff and in Swansea, and just building that evidence base in Wales, not in England, not anywhere else, but what is happening in Wales. And that's another important part of the offer that we can give. So I have actually done that. So I'm going to say diolch yn fawr iawn. If anybody wants to contact me about that, please do, and be really interested in the works. You can follow the work that's happening in Port Preseli, and if you want to be part of this wider, it's a movement really that is gaining momentum across Wales. Please bear that in mind, of how to work in a human, relational way that's learning centric and achieves systemic change across Wales. So thank you. Diolch yn fawr.
Thank you very much. I haven't got much time, but is there any quick question in the room? No?
How does the learning partner thing work, Mandy? Is it you, or have you got?
It's both, actually. Yes, Sean. We have a team that would be able to, within our team, we can act as learning partners, but we cause the capacity, and we can't be everywhere, so we're bringing in some external support. But Paul's team will be in recipients of that, and the other three that you saw, the health boards there, but we are working as well to be learning partners, to build in that sustainability, so we don't always have to be bringing people in to do the work that we can eventually learning partner ourselves. And that again is the social learning community, where there's that peer-to-peer learning partnership that's going on.
But right now, if we came to you and said, right, we want a learning partner to make this happen,
You can come, you can ask. You can ask.
Mentoring.
Yes, yes, yeah, get in contact, Sean, and we can see what we can do.
What small thing we could start
Yes,
with.
yeah, because that's the thing about these experiments. It doesn't mean we're going to change Wales tomorrow, but we can change a little bit of within your arm's grasp of what you're doing, and it can be anything. We were talking earlier about it could just be a very small experiment or exploration. It could be how you do your meetings differently, your team meetings, focusing it on learning, not rather than going through the agenda and targets and everything you might want to do. Change it. Just do a small learning experiment there and see if that's a better way to be working.
And we're centering this in Pembrokeshire around Porth Preseli. And Porth Preseli is as much the local authority as it is health, as it is WAST, as it is PAVS with the community connectors. It's all in there. Visit. That's the best way to experience it. Come and see us. Jess is on the call. I presume Jess is still there. Jess is one of our most instrumental managers in the team, and Jess will be able to share some of the difficulties of holding this, because this is really, really challenging to hold, and it's fine putting it in a picture that we've got some zone, but the holding it is one of the hardest challenges of this, because we really are against the current. And it's so easy to be swept away again in the different, and Jess feels that in a very, very strong way, and that's something that she can share. Together we can support this much more robustly, and you would probably need to be supporting the support of Michael or somewhere to like, or the Bevan Commission, or and Improvement Cymru is holding with us. It's all holding it,
and all of us holding it together, that space.
So I'm thinking you start building a very small coalition of the willing in your organisation, in your system.
Yes.
Don't use the word pilot, do we? Experiment.
This isn't a pilot because there's no other way. This is how it's got to go, so we don't see it as a pilot. This has got to grow and grow and grow, and so we haven't. One of the really interesting things is that we typically haven't asked for any more money for any of this. This has come about because, just like that infographic, the infographic has come about because that's what we have co-created. And therefore, that infographic is just a shadow of what really is there in people's understanding, because that's what we have drawn as a consequence of everybody's views, and people have agreed that that's what. But there's this. It's a huge wealth of knowledge about what we can do. It is behind that infographic. Whereas if you impose that on somewhere, you have just got an empty sheet of paper.
I think there was a question, was there?
Yeah. I think, again, from a very limited understanding, I'm a master's student in behavior change, but I have some prior understanding in public health. I've done some work on that. One of the things I was rather curious to understand is how do you build trust when you're approaching a community, and how do you build empathy? Because I understand from whatever work I've done, empathy is not an easy thing to build. You might talk about empathy quite often, you need to have empathy, but when it comes to action, it's not an easy thing to do, especially when something I'm collaborating with is not from my area of work or something which is remote, but you need cross-cultural team to come together to form that trust and build that empathy, so that there's a scope of understanding, but then there's scope for sustenance also, because you want that. So something if you can quickly do. I know it's a
trust it takes a long time to build. It's very easy to scatter. So everything has to be relational. And we were having a conversation earlier about what's the one behaviour that builds the most trust. Listening.
And practice. That's what I say. The only way that you get something is practicing it by being trustful and trust in yourself and open yourself as well. That's the only way.
With a similar type of project I've been involved in, it's very much focusing on what we're all trying to do is provide high quality care to an individual patient. And by focusing it very much on that care of that patient, that helps develop the empathy and trust and relationships. Because the majority of people want the same outcomes.
And that's why the social learning space is important, because it's the space that we can be honest with each other as well. And so you might be perhaps the only person who's doing this work in the entire organisation or wanting to do that. And that's why coming together with people who are finding it hard, long and slow, you can practice your trust there as well.
We're switching the focus from targets, and it's targets that make us maybe a bit dishonest, maybe needing to say what we think is expected of us. Whereas if you take the focus away from the targets and the measures, and you just focus on what are we learning here together, people are maybe more likely to be truthful about, you know, when you're building alliances with people, to say, actually, this isn't working. What do we do about that?
From my perspective, there's a model in the middle there, which I've been creating for the last 5 years within the JCC, which is based on relational trust. And it's relational trust that we need for complex change. And there you can look across other fields. So you can go into the field of education, where you have children, or you've got the parents and you've got the teachers. And in order to do something, you need to have relational trust between the three domains. And they've done some work which says that you need to be respectful. And so understand what respect is. You need to be caring and demonstrate caring. You need to have you need to be able to do the right things. So there's something in there around the practices that you use, the methods, and there's something about the integrity of all the individuals. And to me, in complex change, integrity means that you have got a route to the knowledge, that you can demonstrate the practical wisdom because you've gone broader. And then the credibility is that element of theory into practice, where you're doing it, you're able to demonstrate you can do it. So it's credibility, integrity, caring and respect are the four components that make relational trust. And if you can get all four, then you have a chance of complex change, because complex change in the end is predominantly social learning and shared, so collective social learning.
I apologise.
Yeah,
but thank you ever so much. Thank you for your questions and coming, everybody. Thank you.
Thank you so
I'm glad
much.
you came. It was